Good afternoon, everyone. Hey, all right. I know it has been a very long day, so thank you again for being able to still be here and being present and still awake. All right, I know they're getting, there it goes, perfect. All right, if you see me looking down, looking at my notes, okay? And if you need me to speak up, let me know as well. So, I will be honest. I had no idea what to speak about today. I was actually very stumped about what I could possibly bring to a room full of people who are very well accomplished within this field, even though I've been in this field for like over 10 years at this point. But as I sat and thought about it some more, it allowed me space to reflect on how I even got here, to this point of my career, to one that is rooted in decolonization and liberation of our communities while using the wisdom of ancestral healing knowledge that science continuously tries to catch up to. And although I have not yet hit griot status or barely even auntie status by some people's standards, it is absolutely an honor that my childlike curiosity sits me at this intersection of both science and spirit, where the two worlds get to commingle in a way that feels good to the soul and authentic to the people that I get to serve in our community. And it has been such a pleasure to hear from my colleagues today, where we are pretty much on the same sentiment. That it's not simply the work that we do, but there is the underlying pieces that are affecting the community that we serve. So, my name is Krystal. Nice to meet you all. I'm a licensed clinical social worker by trade, including being a therapist and a professor at Columbia School of Social Work, as well as a holistic practitioner by ancestral path. Through my background in clinical and spiritual herbalism, yoga, integrative mental health, and newly as a womb practitioner and full spectrum doula, I get the opportunity to see the ways that trauma lives in our body, from our mind to our gut to our roots. And in 15 minutes or less, we'll talk not simply about trauma and how to address it, but also the system as a whole from a different lens. So, yeah, these slides are not going to be like we saw today, just so you know. By raise of hands, who here loves to shop? Perfect, me too. Completely ashamed of how many Amazon packages have come to my door this week alone. But, okay, next question. How many of you all side-eye a tag that says one size fits all? But we still go ahead and buy it though, just in case. Maybe you're the one size that fits it, right? And that's kind of why I have this very cute shark here, right? Quick anecdotal. My fiance decided to buy us some sharks because we wanted to be cool and corny. I am 5'6" and he is north of 6 feet. It fit neither of us. I could barely get my head in, and if you can get a leg in, that is a miracle, right? So this is what I think about when it comes to the systems that we work in. One size fits all could be really misleading if we aren't asking these right questions. So when we're talking about the medical and mental health industrial complex, I think of everything from our use of the DSM, diagnostic assessments, and simply the way that we approach a problem, where all of these are seen as one size fits all. And it's something that I've always known in my gut. And as I used more and more of these assessments or evidence-based practices while in the field, when dealing with people who experience various forms of trauma, usually young people at the time with various ACEs scores, but also the adults that were in their lives. It never accounted for nuance, for culture, and for ancestry. It forces us to see our clients through just one lens, as if it is the one. More like a magnifying glass and less of the multiple lenses that we use when we go to the eye doctor to see which one fits the best. And in doing it in that way, It forces our people into boxes that just doesn't fit right, much like this chart. All right, before I continue, show a really quick overview of what I'm going to try to cover in about a little less than 10 minutes. All righty, so back to this complex. So it should not be a secret at this point in time that Black and brown people were not made for the system. As I hinted at before, many of the things that we use to measure was actually created to our detriment. Again, everything from the DSM to psychiatric hospitals. When it came to the breakthroughs that pushed the sciences that we use now, it was usually on the backs of the marginalized, and usually started with some level of ignoring the cries of the very people who came to them for support. And we won't even get to whether they were asked permission or consent. Though we know the names of some of these through history, such as the Henrietta Lacks, the Tuskegee syphilis study, for sterilization, we are not that disconnected from the reality that we currently live in. There are many studies and anecdotal evidence that shares the same themes. Black and brown people continue to not feel seen or heard within the medical and mental health system. It is the thread that connects the past to the present. So what does it mean to neither be seen or heard? To be a number instead of a soul? Well, if you ask the community, it might sound something like this. And I quote, "You talk about mistrust. How do you, as a Black person, sit back and say, what does care look like when you've never had it before?" End quote. Or, quote again, "I understand more that we as Black folks have become so intimidated by somebody that we think knows more than we do about our bodies that we just sort of sit there and take it, go somewhere quietly, and suffer. That's what they want us to do." End quote. Both of these quotes were taken from a recent study from the Massachusetts Health Quality Partners from a January 2025 statewide patient experience survey. These were shared to remind you all that re-traumatization rears its head every time a person goes unheard. Intentional or not, the harm is there when their words fall on deaf ears. If they can't trust their providers, who can they trust? So it's easy to simply see the people that we work with as numbers, unfortunately, especially when we are working within these systems that value quick visits, insurance panels, and other funding sources. So I would love to share an author with you that I fell in love with recently, Dr. Jennifer Mullen. She's a psychologist and author of the book Decolonizing Therapy. And she says it best, and I'm not one to really read off the slides, but I'm gonna read off of it today for us. So she says the Eurocentricity and privilege of our clinical practitioner-oriented programs focus more on what is defective with the mind as opposed to one's experience. The belief continues to pathologize the person seeking help. We have been taught to medicalize and treat symptoms, yet we continue to ignore the soul wounds of historical trauma and colonization. We victim blame by focusing on personal deficiencies in trauma rather than structural violence. There is an unspoken yet deafeningly loud cry from our community to see them as their full selves, not just as an individual, but a member of a community with shared history. As we should, as we always should have. Because that is what allows us to see things such as community trauma, ancestral trauma, their lineage of health, societal ills, systemic barriers, and then looking at their experience of it and how their body has been responding. That then becomes the missing key. How do you get to know their full story so that we could best support their full person? Because the reality is, some of our methods or treatments serve more as a Band-Aid, that one size fits all. I couldn't tell you how often I've heard from people who get told by professionals that what they were experiencing was just stress and told to just deal with it. I was one of those patients. Many things get brushed under the rug as routine, yet no one questions why these things are so common. What am I not hearing right now? And when it comes to trauma, what is the bigger picture of this story that could bring more clarity on how I'm approaching it? So when we're talking about trauma, I'm throwing around a lot of terms right now, so let's go ahead and define some of these. So starting with decolonized. And first off, before we get to decolonize, I'm gonna go back to Dr. Mullen to talk about what the colonization has been. So here, colonization refers to the behavioral, psychological, institutional, political, spiritual, interpersonal, and economical methods that have exploited and oppressed indigenous peoples globally, historically and present day. So when we're talking about decolonizing, we're talking about the undoing of these colonial influences. We're asking the questions of who's writing the history, who wrote our manuals, and what makes what we do evidence-based. I've always asked this from day one when I started getting evidence-based manuals. Who did they study this on? Because some of the work that I was using would not have fit the population that I was working with. And for context, I was a school counselor using books based off of like substance use and prevention, and using that in Far Rockaway, where Far Rockaway is predominantly Black and brown, usually of immigrants. If I did not twist them and made them a lot more personal, my kids would have laughed me in my face. Still loved me, but also laughed in my face of what I was doing to them. So we should always ask these questions. Who was it made for? The next one we have here is trauma conscious, and I'm using one of my teachers and her definition. So Natita Gessel, who's also a licensed clinical social worker and the creator of the trauma conscious yoga method, describes trauma conscious as embodied, intuitive, curious, and honoring the lived experiences of the people that we're working with. All right, so what does it actually look like in practice? So this is where we get to be integrative, holistic, and comprehensive. Okay, so this first slide is talking about if we cannot name the thing, we cannot fix the thing. We cannot address it. So this looks like naming the white supremacist and capitalistic structures that we are working with, and how it is directly or indirectly impacting our clients. It looks like naming and recognizing the policies that are impacting the clients. And if applicable, really looking at their migration stories. And yes, this is also including those who are foundational Black Americans, and looking at what was the migration story and how has the family told that story throughout the generations, because that also still connects the thread. The next one here is looking more at the larger scale. So we're examining the role of community trauma, whether immediate lived community or that of their ethnic, cultural, and ancestral communities, including the LGBTQ community. We're looking at their spiritual practices, whether organized or otherwise, which are also important to know about their holistic wellness. I'll pause here for a second. Whenever I'm looking at integrative care, as was last mentioned by the doctor, spiritual wellness has to be a part of that too. There are going to be some things that we are probably hearing from our clients that may not show up in a test. And that is where our community healers come in, but I'll get to that in a moment. And lastly, looking at that complete historical narrative for context. Right, so we're understanding the levels of personal, community, social, political, and ancestral knowledge is key to their holistic care. As we're talking about trauma, there is a lot of strength happening within these different parts and sections of these people as well. So maybe something that has helped me that could support you all, if you weren't pathologizing, if you weren't diagnosing, how would you support this person? If you didn't have to worry about putting in that IC code, what would you do? All right, so this is where we start expanding our field. And it's important to have alternative healers on call to address what may be outside of your own scope. So when we're talking about somatic practices, we're looking at those who practice Ayurveda, traditional Chinese medicine, yoga, herbalism, acupuncture, and other body-based practices. Where I know it gets a little controversial, there's also the soul practice as well. So we're looking at the spiritual healers. We're looking at those even beyond being religious heads. So those include the curanderas, the shamans, the womb practitioners, and others within the African and indigenous communities. These practitioners help us to see the things that we may not be able to see with our medical tools. Because oftentimes the traumas that we are addressing isn't just skin deep, it's etched in our spirits and the deepest parts of our bodies. This is how we get there. All right, so let's start moving, I was about to finish up in a second, from our logical mind to our wise mind. So what does it look like now that you all can carry with you all after today? So the calls to action. First is that one-on-one is key. Meeting them where they are. These are things that we already know. Meet our clients where they are. This may also look like revamping your intake process to include questions about their migration stories and their community and their spiritual practices, as well as their current stress management. There's also something I share with my students a lot, is PROP. So this is looking at privilege, race, oppression, and power. The who, what, when, where, and how that is impacting the individual sitting in front of you in that moment. Because I could assure you that there is an intersection that is there. There's quite a bit of overlap. And the last thing here is the co-created care. First and foremost, trusting their body and their word. One tool that I've started to use recently was called pod mapping. And pod mapping looks at the entire community at large for this individual, for them to be able to name it. And it's outside of like, okay, my doctor here or my therapist there, but also my community center, my herbalist down the block, or the person who makes all my green juices. Those are all a part of their pod. We already know that we're coming from communities and working within communities that do not have a greater access of care. Using pod mapping and being able to sit with your clients in this sort of way allows them to identify who do you actually have and how can we help them in planning that. That could also be the social worker in me, and that's okay too. All right. So before I wrap up, because I know we're going to be doing questions in a bit, nothing I shared here today should be a standalone. Science and spirit has an overlap. They play well off of each other if we allow them to. And the Venn diagram here is much more of an overlap than we think. So I do hope that today, in addition to all the amazing information that you have got, that you are able to leave here with curiosity to tap into your own history and healing within your families as you rethink care that we allow as valid for people that we serve. Thank you.